Good
How are you?
afternoon, ma.
Good afternoon. How are you?
I'm very well, thank you. Nice to have you on the show. I was going to, sustain the interest of my listener before introducing you, but of course, your voice just came in pop, so we had to
Oh,
just.
so sorry. I don't know how it works.
Yeah,
Yes.
no. That's fine, ma. That's fine,
Okay,
ma.
no problem.
Well, Lagos, I was going to keep that big secret away from you, to leave you guessing, but it has happened. Yeah, you're hearing the voice of Dr. Mrs. Kemi Ogunyemi, Special Advisor to the Governor on Health, Lagos State. Great to have you today on the show. You
Yeah,
look
nice
so
to be
delectable,
here.
ma.
Well done.
Thank you so much. Thank you. Now, 99.3 Nigeria Info is the dial. We are the talk station of the nation. Ramadan Kareem to all Muslim faithfuls out there. Please, let's not forget, like I said last week, to include in our prayers our dear country, Nigeria, this period. God bless Nigeria. Welcome to Maternity Line. I am Zaynab Yakin, your host. Lagos, I told you the other day on the day of our anniversary that conversation is about to get bigger, better, and even more impactful on Maternity Line show. And you can already have a feel of that. Right? Yes. Some of you actually thought when I was talking about it, maybe I was just a thunging chick. Look at you. Yes, so today we do have a very, very special guest on the show as we take a look at the recently announced policy of free childbirth services that the Lagos State government said would benefit over 50,000 women annually across the state to aid the residents during this challenging times. Now, our health care initiative is set to benefit over 50,000 women annually with free childbirth services across the state, general hospital and secondary health facilities alongside distributing free hypertensive medications to individuals in need. That was me quoting Mr. Governor Babajide Sanwo-Olu. He had tweeted via his verified X handle at Jide Sanwo-Olu. So great to have you with us again on Maternity Line, Honorable Special Advisor to the Governor. Ma, for a fact, I know that this is not the first time that the Lagos State government will be coming up with such initiative. As a matter of fact, we've had a couple of conversations in the past with regards to this, and we even tried as much as possible to get someone like you on the show. But I understood at the time the ministry was busy. I was on the neck of Director of Public Affairs, Mr. Tumbosun Ogunbanwo, before this is now happening. Right, so I know of a truth that this is not the first time, as I said, that the Lagos State government will be granting free medical care to indigent residents as part of ways to assuage the living cost for women and mothers, especially. Now, I would love to start by asking, and I even feel that I haven't introduced you appropriately enough. So I will have to reintroduce you. Now, Lagos, this is essay to Special Advisor to Governor on Health. She has held many positions of leadership, such as Unit Director, Emery chemotherapy nurse, hematology oncology outpatient department at the Royal Free Hospital London. She holds a master degree in healthcare administration and another in nursing from University of Phoenix, USA. Not just that though, this CV is huge, and she's a two-term, so be just be noting it down as I'm saying it. She's a compassionate nurse with over 30 years experience as a cancer nurse specialist, professionally registered in both the US and the UK. Now, look at this one. Her passion for women and children's health has led her to the founding of Afro Healthcare Initiative, which is an NGO dedicated to the promotion of quality healthcare for underprivileged women and children. Not just that, guess what? She is a two-term commissioner at the Lagos State Health Service Commission between 2015 and 2023 last year, tasked with the recruitment and training of all health personnel in 27 Lagos State General Hospitals. I can go on and on, but I don't want to waste our time because we never have time on the show. Remember, sponsorship is also coming up on the show. Now, let me just go straight to my question, Ma. Right. The Lagos State government has been doing a lot with regards to this, maternal health, general public health, and all of that. In fact, there have been various schemes put together just to ease families, women, pregnant women, of financial constraints. Now, with regards to the latest one that was announced 22nd February last month, exactly 1 month, I would love to start by asking, when is this new Lagos healthcare initiative newly announced by Mr. Governor saying it will benefit 50,000 women annually kicking off? When? Or has it kicked off yet?
Thank you very much for having me. Absolutely. Thank you. Really appreciate it. And it's a good opportunity to give proper information to your listeners, to the public at large. So thank you for the introduction. Yes, let's go straight to the cocoa of it.
You're right.
Mr. Governor has a caring heart and is concerned about what is going on in the country at large, but for Lagos State, especially where he is the executive governor, this has come out in terms of the palliatives, the interventions that he has put up. First of all, let me just correct you.
Okay.
The free antenatal care has already started. It has already started.
Great.
What he's done, and like you said, it's been done before, but this is different. This is something that includes free delivery, whether it's a cesarean section or not. Everything from the time the mother is pregnant to when she has the baby,
right.
It is free. Now, the reason why, so last year, the initiative actually also started last year. I think the reason why we revamped it, we looked at it because we also have a program called Lashma. That is the health is Irico, which is a free health, which a lot of people haven't really understood properly and taken up. And so with that in mind, what he's also done is we're also going to give pregnant women an opportunity to have free Lashma, free health insurance, free Ilera
Eco
for 1 year. Ilera Eco for 1 year. So not only right now, whether you have it or not, you are going to get free antenatal care, but we're even going beyond that. Some of them will have, those who do not have, will have Ilera Eco. They must be registered though,
right,
with LASRA. They must be registered in Lagos for them to qualify to get it. So in answer to your question, absolutely, it has started already.
All right.
No pregnant woman should pay.
Okay. So why I wanted to make that clarification was because we've had some of such initiative in the past. I'm talking about last year, August, when the governor announced that there will be one as palliative relief for Lagos State residents, indigents. And this is another one right now. And there are reports of people saying that when they go to the hospitals, they are asked to pay certain amounts of money in spite of the free package that the Lagos State government has announced. So now, in the real sense of FREMA, is it that there are certain things that pregnant women, when they go to the hospitals, they must pay for? I mean, the likes of, for instance, maybe a cotton wool, if at the point of delivery, or detergents. They are not going to be supplied detergents and the rest of them. Please, can you speak to us on the essence of that free itself?
Okay, so I'm glad you asked that question, and we have heard, I wouldn't call them complaints, but comments about that it is not free, that they've had to pay for certain drugs.
Right.
So what happens so when you look at normal pregnancy, normal delivery, what we've done is we've charted the path. You're pregnant, you come in, you get your checks, you need maybe multivitamins, and stuff like that. And then, so we've charted it up until when you deliver. That's your norm. That's what we want. That's what every woman prays for. However, life is not like that. There might be occasions where the woman develops an infection. Okay. She might even, I won't say malaria because that one is common and the drugs are free. They may develop some other conditions that nobody really anticipated.
Right.
So they fall out of, so the drug list that is under Ilera-Eco, for example, there's a drug list that we stay on. Those are your standard, normal drugs. Anything that deviates from there does not fall into that. That's special. That means there's some special drugs that the person has to buy. So they have to pay for that. It has now passed. It's no longer about the child, the pregnancy. It's because there's a disease condition, which may go on for a while. So that person has to be responsible for that. There are not that many people that fall into. So we've got the 80-20 rule, 80 being your normal, and then the 20% that will have one thing or the other. That is where they have to pay for certain things because it is not covered under Ilera-Eco, under your norm. And that's why people are having to pay. And that's what they're complaining about that. But when I went there, I had to pay for this drug. Everything else is under, it's part of the free. Free is free.
Free is free.
I come in, I want to have a baby. I'm being checked out. The doctor is looking at me. The midwife is looking at me. I'm preparing. I have my baby. Some may have cesarean section. They're not paying anything. They may have a normal delivery, that's fine. And I'm discharged home, and that is it. That's the end of that particular cycle, which is usually 9 months.
Okay, so essentially, this package is only valid from the prenatal period. It doesn't extend to postnatal. That is after delivery.
Yes, it's totally different. So after delivery, you've had your baby's fine, we've checked out your baby and all that. Any other thing after that, because that's the end of the pregnancy.
Right. You're right. Absolutely.
We're done with that section of the life. Exactly. Now we want your baby to grow, to be healthy, to everything to be okay. That's a totally different thing. However, if they have Ilera-Eco, which is a 1-year plan, insurance scheme, anything after that may come up, it's still Ilera-Eco for as long as it's valid for the 1 year, you still get the things free. That is why it's so important that people know the value of having Ilera-Eco.
Okay, thank you so much for emphasizing that, Ma. With regards to the Ilera-Eco, the form of identification and all of that. So you did state earlier, Ma, that even if they don't have, they can go and they'll be attended to. But does that mean that if somebody, okay, Ma, does that mean if a pregnant woman does not have this form of identification, the Ilera-Eco, or we talk about the likes of Lashma or the Lastra card? Lastra specifically, Lastra.
Yes,
registered. I hear in some hospitals they can be easily registered. They can be easily enrolled before they enjoy the service. Am I correct?
Absolutely. It is such a nice. Lastra has done a phenomenal job. They're everywhere.
All right.
They're everywhere. And it's easy. It's actually very user-friendly. You just go, you get your Lastra, you're registered, and then you're able to access a lot of the initiatives that require that you be a Lagos resident. And I'll tell you, this is so important because, Lagos is a center of excellence.
Please, I would love for you to
number of people.
Ma, please, I would love for you to repeat that because we lost your voice just for a second.
Lagos State, right. Lagos State, is the center of excellence.
100%.
The people joke that when Lagos sneezes, all the other states catch a cold.
Right.
Whatever we do. Yeah. So what we do, and we want to maintain that. We are a center of excellence. We want to do the best we can. We have the best hardworking people, especially in all areas. And I'm talking about health now. But the problem we have in Lagos, and I'll tell you this, is because Lagos is like 0.6% land mass in the whole of Nigeria. 0.6, very small, very, very small state. right? But guess what? We have 15%. We house 15% of the population of Nigeria. That's huge. People are migrating, they're japaring from the states to Lagos. And when they come in, guess what? It's kind of like a strain on our services. So our hospitals are overpopulated. So, and we have to cater for them because we're not discriminating. We're not saying because you came from the north and you now live in Lagos, oh no, you're not in Lagos, we're not going to treat you. We are. So there's the schools, there's health. So we have a lot of people. So for us to even do better, we need to have people register. Also, it helps us with our data. So when people are registered, we know, do we have a heavily older population? How many children do we have? How do we cater for this area? Where do they live? So do we have a lot of pregnant women in one section? It gives us information to make decisions on how we can carry out the best healthcare possible, give them quality care, ensure that everybody has access to quality care, which is our aid.
Of course, I can't agree any less because of recent, even Lagos State ranked 8th in Africa with best healthcare services. So I absolutely understand and agree to all that you've said so far. But I'm glad you also mentioned, you made a reference to data. And this is taking me back to the tweet by the governor, where he said 5,000 women. And I'm thinking, how is that going to be made possible? Is it going to be based on local government or local council area kind of how do I put this? I'm looking for the right words to use. Now, is it going to be based on local government areas? Because the data governor has said is 50,000 women. So how is that going to be calculated for women, for each and every pregnant woman in Lagos right now who is willing to register to be a part of this package? How do they go about it apart from the identification that we discussed?
Okay. So, our primary health care has been divided into 6 districts.
That's right.
Districts 1 to 6, where we have a permanent secretary leading each district.
Right.
So, and then we also have the primary healthcare centers that are 24 hours, they're all on different grades. So our pregnant women, now, the women are not pregnant all at the same time per se. So when they have a baby, so that's less. So when they register, that's what I'm saying, last right is so important. So when they register for they're coming for antenatal services, we already know that this person is pregnant. And let me just tell you that number is what we even have now, because data is very difficult to collect because some pregnant women go to traditional birth attendants.
That's right.
So we don't even pick them up. So we don't pick them up. These are the ones we know for sure are registered, not only in the primary healthcare section, but also secondary facilities. So what happens is in the primary healthcare center, so a pregnant woman goes there, registers, right? We also have electronic systems now. That's the kind of technology we're using. So some of them already have Ilerico. They already registered with LASRA and they already have their insurance.
Right.
They are good. They are fine. They don't need anything free again. They're already registered. They've already got their card, and they go in and have all the services that they need. The ones who are not registered are the ones who are actually going to get it free.
Oh.
So out of the 50, let's just, for argument's sake, let's just say, because I don't have the numbers, let's just say out of 50,000 women that Mr. Governor quoted, let's just say 30,000 have Ilerico. They'll have the insurance. So we're really only giving free to the 20,000 left.
Oh,
and we're encouraging the 20,000 to please register with Ilerico because it takes them further than when they deliver. And it covers their babies.
Right.
And it covers so many things. It is probably one of the best things. It's just something that we're encouraging. And so we have LASHMA all over the place as well. All the hospitals have the offices there so that they can actually go in and do. Right now, by the way, it's 8,500, but it is going to go up. It's because of all the costs and all the cost of drugs. We also feel the effects of that. But overall, regardless of how the increments of the cost, the thing is, it's still cheaper for an individual to actually have Illyrical. They won't pay as much.
All right. Thank you so much, Special Advisor to the Governor on Health
You're
in
welcome.
Lagos State. Lagos, you are listening to the voice of Dr. Mrs. Kemi Ogunyemi. Are you a pregnant woman? Oh, I'm saying something is wrong with our studio line right now. Engineer Save, if you're listening, please come through because I'm guessing people might have started calling into the show. But I know you can hear me. Are you a beneficiary of the ongoing free medical services by the Lagos State government or from any of the pre-existing schemes initiative of the current or past government? Or do you have questions for the essay on this particular subject, or are there other specific material or maternal child and care initiatives of the Lagos State government, present and past, that are still running you want to know about? The studio lines 0201 465 7190, general line 0700 993 993 993. You can as well drop your WhatsApp message. Flood us with your messages. We are expecting them 0809 597 5805. Dr. Ogunyemi, I still have more questions, but I would love to take feedback from my listeners. Please permit me to just take 1 minute break. I'll be right back, ma. Thank you so much. Thank you.
Sure. All right.
All right, Lagos, thank you so much, Madam Ogunyemi. Thank you so much for permitting me to take that 1 minute break. Now, I have a message coming from Sylvester. Sylvester is messaging from Lekki, and here is what he says. Sylvester says, good afternoon, Zaynab, and our esteemed guest. Please, ma, for those of us that have made part payments in Illyrical, does that mean we don't have to pay the balance? Do you get that, ma?
That's a good. Okay. That's a good question. But you know what? I would say pay your balance because, like I said earlier, it extends further than when the pregnancy ends.
All right.
It's not so your Illyrical is not just for the pregnancy. The Illyrical goes beyond that for as long as it is valid. Because if you don't pay your full premium, then it's not valid. Then you just basically wasted what you've already paid. So you pay your full amount and you're covered for the 1 year that you're covered for. If you stop paying and you just want to do this free ANC, you still get the free ANC, but you're going to lose out on the Illyrical.
ANC is antenatal care.
Antenatal care. I'm sorry, antenatal care. Yeah. You don't want to lose out on both. The best way to go is Illyrical.
All right. Thank you so much for that explanation. Now, this one is coming from MJ. MJ says, good afternoon, my people. Please ask her these few questions regarding Lashma. Hardly do they have drugs prescribed by doctors in their pharmacy. Why? Second question, payments is so difficult to make by policyholders. Most banks will say the payment platform is down and this continues for weeks. The USSD platform is impossible, etc. He wants me to ask you that question.
Okay, so the no drugs, obviously, like I said, there should be drugs unless it is off the list. So we've got the list of lyrical list. You can't list every single drug, and there's some drugs that we're not going to keep if people are not using them. So we have the most common drugs and the ones that we know that people are going to obviously need and use. The ones that you have to pay for are the ones that are off the list. And I'm sorry about that, but it's just maybe only 1% of people use those drugs, and there's no point in us keeping them when they have an expiration date, and then it's a waste. So unfortunately, people have to buy those drugs that are off the grid, as I put it. Regarding Lashma, yes, like any electronic, in any technology, you always have downtimes or something's not working. And I know they're on top of it. They have an ICT department. As soon as we hear something's wrong and people call in or over here, we go straight back. However, having said that, I will go back again to ensure that this thing is what your caller said, and to make sure that it's seamless. When people go in and they want to make their payments and all that, is it now working? And I know they check it from time to time, even if we don't hear anything, to make sure that the line is working. So it's good for us to hear that when it's not working for somebody. And internet is one thing, and we all have issues with them. So hopefully that's been resolved.
All right. Thank you so much, Honorable Special Advisor to Governor Sanwo-Olu on health. It's an honor to have you. It's an honor to have you on the show today. Ma, before you go, this is meant to be a 45-minute show, and we have a sponsorship coming up soon. It's already time, the time for our sponsorship, and I would love for you to please still stay with us while we quickly pass this message across to Lagos. Thank you so much.
Absolutely.
Thank you.
No problem.
All right.
No problem. All right.
Hey Lagos, hi moms and dads. So if you're looking for a reliable and trusted brand for your babies or your toddlers, then you should be thinking about Yara diapers, okay? Yara is committed to providing high quality, comfortable diapers. They are so soft against your baby's skin, and they have no leaks or issues, okay? So the incredible features of Yara diapers is the breathable layer. Okay, it doesn't restrict airflow to your baby's skin. Then they have an elastic band to comfortably fit your little one without leaving marks or creases, and it has super absorbent beads that would help you manage and maximize absorption. So it also has a very good anti-leakage system, so your baby can enjoy dryness and comfort. And they are lotioned with aloe vera as remedy for rashes. I know that rashes is a big issue when it comes to buying diapers, so you want to be careful about that.
I know.
Exactly. And finally, it has wetness indicator, so you can tell when your baby's diaper is full. What else are you looking for? Join the community of Yara parents who trust and rely on Yara for the baby care needs, okay? Experience comfort and reliability today. And Yara diapers comes in different sizes. We have newborn 2 to 5 kg. We have mini 3 to 6. We have midi 4 to 9. We have maxi 7 to 14 kg, and we have junior 11 to 18 kg. For more information on Yara diapers, you can call 0810 753 9603, 0810 753 9603, or you can visit their social media handle to check more. On Instagram, they're at yara.diapers on Instagram, and on Facebook they are Yara diapers. That is Yara in small letters, Yara.diapers on Instagram, and on Facebook Yara diapers. Yara, the diaper that fits your little one.
Yes, Kemi, thank you so much for that information. Please do stay with us. Yara diapers, you've got to get the right size for your child. Don't be like my neighbor Yabingpe, who was going to gift someone with the same diaper because I had spoken to her about it, and she went to the market to get the wrong size. I'm like, why? You should have even asked your friend who you want wanted to send this to, so don't be like, go on their page right now, Yara Diapers, that's Yara.diapers, and of course
IG.
on Facebook, check for them, and they have this different sizes, newborn 2 to 5 kg and the rest of them. And I'm glad we have the SA here. Of course, she's a mother and she's very passionate about children and women, and she has something going on. Something going for women, underprivileged women and children. So this might just be a perfect avenue, to engage the SA on a view with regards to diapers around, because SA, I know this was not supposed to be part of our question, but of course things are expensive right now in the market, and I understand the Lagos State government is doing a lot already to ease the tension, the financial constraints and all of that. We would love for the Lagos State government, because we have someone like you here on our show already, to please also help factor in something like this. Diapers and some other things when our mothers they give birth and they need more help with regards to diapers. Things are quite expensive right now. Please do help us look into that, as well as the sanitary towels for our
females,
preteens, for our teenagers, for young girls who are, because things are quite expensive right now. Please, do help look into that, so life is easy for everyone, including mothers and young girls.
Absolutely.
Yes, thank you so much, Ma. Now, I have more questions. Kemi, you are stuck with me today on the show, so you are going nowhere. Ma, part of the questions Lagosians are asking is, are there enough facilities in the state? Oh, I have a caller. Please, let me pick this call. This is what we have been looking forward to. Good afternoon, Lagos.
Good afternoon, madam.
Good afternoon. Do you have any question for the SA?
Dr. Kemi.
Hello, how are you?
I want to ask, please, in this last RA, does it have a price tag? And if so, does it have a renewal? Is it yearly or monthly? Can I know, please?
Last RA is free. Last RA is free. It's a registration. It's free registration. And now you even get, as far as I know, you get a card, you get a number, and that's it. You don't even have to go back there. That's it. You're registered. You have a last RA number, and that is what you use to, and you may access interventions, palliatives that require you to have last RA.
Okay.
That is just a Lagos thing, and it's one time in, and that's it. You don't pay anybody anything for last RA.
Dr. Ogunyemi has said you don't need to pay anything for last RA.
Just register.
Just register.
Just register.
Please, Ma, are there telephone numbers for complaints in case people go to the hospitals and because I've come across a lot of such complaints. They will say, oh, we need to report this case because when we go to the hospitals, they tell us to buy this, they tell us to buy that, and they are telling us this is free. If you don't even have the telephone number right now, I can get it right after the show and tweet it. But if you do have it, Ma, please kindly share. Oh.
People are bombarded.
The internet is beginning to play up on us. Hello, doctor. Can you hear me, Ma? Hello, doctor. Wow. I can't. Doctor is she's talking, but apparently we
go. But I'll get you the numbers towards the end. Yeah.
We didn't quite get that, Ma.
You were talking.
You were.
No, what I'm saying is that I will get you the numbers, and then you can share with your guests, with your audience. However, if people go into the hospital and somebody's requesting for one payment or the other, all they have to do is ask for who is in charge.
Okay.
They can ask for the MD, they can ask for the head nurse, they can say, I want to know why I'm paying for this and then they can explain to them why they're paying for certain drugs, or even if they go to the pharmacist and they say, oh, no, it's like, oh, but this drug is a normal drug, it's just a vitamin, and I'm being asked to pay for it. You have every right to to ask a question, and then they will be able to explain to you, I'm so sorry, ma'am, this is not on the list. This is a special drug for this and that. That's why you're paying for this. Information is very important. When people know why they're doing something that is out of the norm or what they understand, then people accept it rather than not knowing and all that. But I've explained earlier the reason why some people have to pay for certain drugs.
Right.
I'll get you the LASRA and LASHMA number to call. Yep.
All right. So okay, do you want to do that right now, Ma, or later during the conversation?
No, I'm getting it for you. I have to make sure I get the right numbers.
All right, thank you so much.
Contact numbers, yes.
All right. So the question I was going to ask the other time, part of the questions Lagosians have been asking is, are there enough facilities in the state to cater to the influx of people that will be experiencing this, that will be going or visiting hospitals for this free medical care? I understand we have about 27 local governments.
So we always, with everything, regardless of whether it's antenatal or just generally feeling unwell, we're trying to encourage the people to go to the primary healthcare centers first. And then also we have the maternal and child's care centers, the MCCs. So we don't want you to go, somebody's pregnant, we don't want you to go straight to Island Maternity and say, I want to, and then you leave your primary healthcare centers, which is in your community, nearer to you, where you're just going to have your normal antenatal check. So everything starts from basic, and that is our primary healthcare centers. And we never have enough, because like I explained to you, Lagos is just growing. We have so many people coming in from other states. We also partner with the private sector. So some of our private sectors take LASHMA, Ilera Eco cards, and they will see you. They're registered with HEFAMA, which means they've been they're regulated and they're fine, and we've given them a license to practice in Lagos. So you can go there as well, as long as they take Ilera Eco. So we're building what we call partnerships with private sector, so that there are more avenues for people to make their choices, especially closer to home, to where they live. So antenatal first in the primary healthcare centers, and then you can be referred, if necessary, to, say, Island Maternity, and all that, yes.
Thank you so much. I love the fact that you've alluded to the partnership with private facilities as well. Some of the things that discourage women, sometimes pregnant women, is when they go to quote and unquote government facilities, they don't get attended to in time. I've experienced that myself, and then I was forced to just find a solace in another private facility, and I was well treated. But after that, I've been visiting government hospital, and I have better impression right now anyway. But then again, Ma, being a nurse, I mean a registered nurse of so many years of experience, over 3 decades, you are a very adept trainer, and as someone who has successfully implemented the training of all employees in the secondary health facilities in Lagos State on customer service and attitudinal change, there have been reports and counter-reports about poor attitude of nurses towards patients, including pregnant women. How do we address this? Do we need to retrain our nurses, or is there anything? I've asked these questions over and over again, even from other pediatricians, other professionals when they come on the show. How do we address this, ma'am?
Yeah, well, we are addressing it, and it's getting better. It's not as bad as, say, before, and it gets better. You never stop training on customer service. We have to keep on reminding us. I mean, it's not just nurses, it's every single person in the healthcare sector. And then there's some people who are not nurses that people assume that they're nurses. And I'm not making any excuses, but you're very, very right. One of the reasons, years ago, research showed that the reason why pregnant women do not go to the hospitals is because they feel that they're not being treated well. when all they're doing is coming to have a baby, and then the nurses, the midwives are actually rude to them. So when I first got back to Nigeria, one of the first things when I started at Health Service Commission was to start that customer service and attitudinal change, which is really dear to me, because I just believe that apart from being pregnant, where you're pregnant and you come to the hospital, most people don't want to be in the hospital. They don't want to be. They'll rather be somewhere else. But health is wealth. You're not feeling well, you now go to the people you entrust to look after you, and then you're also paying for the care. There's no reason why anybody should be rude to any healthcare worker should be rude. So what we're doing in Lagos, and we continue to do it, and Mr. Governor always approves for the cost of training everybody, especially those frontline workers, is to retrain and retrain and retrain and keep on learning about people.
All right. Thank you so much. You've just alluded to another point with regards to frontline workers, and I would love for us to talk about it, but time is not on our side.
Yes,
Ma, please, we need to take
fine.
another break just for 30 seconds. We'll be right back. When we come back, we can sign out. Thank you so much.
All right. No problem. Thank you.
Hey, Ella, your baby seems so comfortable in those diapers. What brand are you using?
We switched to Yara diapers. Yara is committed to providing high quality with features like ultra green layer, lotion with aloe vera, wetness indicator, and a breathability layer. They are also very comfortable diapers. They are so soft against my baby's skin, and we've had no leaks or issues.
Join the Yara parents who rely on Yara for their baby care needs and experience comfort and reliability today. Visit our social media handle on Instagram at Yara.diapers or Facebook Yara Diapers. Yara, the diaper that fits your little one.
All right, visit their social media handle, Instagram at yara.diapers, and search for them on Facebook. And the telephone numbers to call 0107 Kemi.
Yeah, 010-753-9603, 010-753-9603.
All right, thank you so much. Ma, my last question, we don't have time again, but Ma, please tell us you will love to come back on Maternity Line. Please. Lagos.
Absolutely.
Okay, Lagos,
Absolutely.
She had just said it. She would love to come back on the show. Anytime.
I have the numbers for you, by the way. Let that be the numbers. Do you have time, or should I text it to you and then you can always tell them
Please
another
text it to me. Text it to me, then I'll share.
I will, because I know you're pushed for time. I've got the Lashma number and the Lashma numbers.
All right, I'll reach out to collect them so I can share.
Thank you so much, Zaynab, for having me. It was a pleasure.
Thank you
giving
so much,
information
Dr.
out
Ogunyemi.
anytime.
All right, I'll always
then.
reach
Thank
out.
you
Thank
so
you so
much.
much. Enjoy
All
the
right,
rest
then.
of your day.
Bye-bye.
Bye-bye.
You too. Bye-bye.
Live from the heart of Victoria Island, you're listening to your number 99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info.